I tried to come on here live a few days ago and talk, but my anxiety was getting the best of me, and I'm not feeling very good right now, so I don't know how long I'll be on. I'm gonna save this if I like what I've said, so I don't really care if no one's here. But I'm having a hard time finding a therapist and an extremely hard time finding a neurologist. I want to see a therapist for a lot of reasons. Like, I need to work through some trauma. I'm having difficulties with some unhealthy coping mechanisms surrounding food. And, you know, just the issues with, like, what do you call it? My brain's not working. Every time I notice somebody pops on here, my brain just, like, stops working. Hey, baby boy. I need to get used to doing lives and people watching. Crap. Basically, I need to see a therapist for several reasons, and I'm having a hard time finding one because, and one of the reasons I want to see one, out of the many reasons I want to see somebody, is because I have something called executive dysfunction. I don't think, it's not even that I don't think, I know a therapist can't, like, cure that or anything, but maybe they can try to help me find some ways to, like, work through it and, like, cope with it, because screaming at yourself in your head to do something and not being able to get yourself to do it is the most frustrating thing in the world. And hello. And trying to work through something like that is the most frustrating thing in the world. Like, Lily, let me get the Lily back inside. Hold on. Come on. Okay, sorry about that. One of the most frustrating things in the world is, and it doesn't even just affect, like, the finding a therapist and finding a neurologist. It affects everything, and it is probably one of the most biggest thing that affects my health negatively, because it makes taking medication hard. It takes, you know, just fucking what's the word, like, washing my hair, hygiene is difficult because of it. Like, and I'm not saying that it's the only thing, like, you know, pain, fatigue, all those things, of course, yes, they play a role in that stuff, but it would be so much easier if I had some help with the executive dysfunction, and I needed a neurologist to help me with it too. But so trying to find a therapist or a doctor or whatever, and you know you need to do it, but you know when you do look for it that you're going to have issues. And the issues that I'm coming across is, like, for 2 years, I needed a therapist, and I'm like, I'll look, and I never did it. And then I finally found one that I really liked, and I saw her once, and I fucking loved her. She was perfect, and it played into this stupid ideal fantasized thing of what I want a therapist to be, which is, like, you know, a big fucking couch, and you get in there and you can hold their pillow that's on the couch and you can talk. I don't know why that makes me so excited, but I've always wanted a goddamn therapist with a fucking couch. Always wanted it. I hate going to a therapist and sitting in these uncomfortable fucking chairs. It like, ooh, I hate it. Anyway, I found this lady. God, I loved her. At first I don't know if I'm gonna like her. But then I started talking to her, and I fucking fell in love with her because she asked actual questions. Like, she made me, in just one visit, she made me, like, confront things that she noticed I was doing that I knew I was kind of doing in the back of my head, but I didn't want to like confront that issue. And you know, granted, I never admitted to that in the what do you call it, the session, because it was just one session. But I've always wanted a therapist that did that stuff. I hate therapists that just sit there and let you talk. I want them to actually, if I'm going to pay somebody to listen to me, they need to give me their perspective from a person looking outside in and show me what they're noticing that I'm not seeing because I'm sick and my brain has these like blinders on. And she was that kind of therapist. And she had a fucking couch. As stupid as it is, she had a fucking couch, okay? That is dumb. The most, like, trivialist thing ever I could want. But she had a goddamn couch. And I got to see her once. And then my insurance changed. And even let's say that my insurance didn't change. She was still really expensive. She took my insurance, but it was like $100 to see her every time. So I don't think I would have been able to see her as much as I wanted to because it was so expensive. And my parents aren't going to pay for my therapy because I think therapy is bullshit. So, you know, it's the executive dysfunction and the knowing that trying to find a therapist that I like, and they don't have to have a couch. It's just something that I want. But just finding a therapist that I like. And what I want in a therapist is somebody that's actually going to, point out things to try to push through the blinders in my head. They cannot be spiritual of any sort. What do you call it? Like they can be religious and everything, but I don't want them to bring the religion into the therapy. I'm an atheist, and the last thing I want is to have a therapist bring in their God crap, because a lot of my trauma is related to the religion, and I don't want that. And I live in the Bible Belt, so that is very hard to find. Almost every person is a is a Christian therapist. And when I think of Christian therapy, to me that just tells me that they're putting Christian in the title because they're allowing their religion to contradict what science is telling you. Granted, that is not true for all Christian therapists. You can be a therapist and suggest certain religious things along with scientifically proven stuff. But most Christian therapists, from my experience, are not like that. They're going against the scientifically taught whatever the fuck the word is, things about therapy. So I don't want a therapist that is going to do that. I want just a standard therapist that is going to do their job and will help me work through my religious trauma, will help me work with my trauma growing up, will help me work up with the medical trauma, help me work through just everything that I need to work through, from my issues with food all the way to dealing with my chronic pain. And I'm having a very hard time finding that. And every time I look, I get more and more discouraged, which then feeds into the executive dysfunction. Because I'm sitting there watching something or reading something or crocheting, screaming at myself in my head to fucking get on the computer and try to find a therapist. But then the other side of my brain's like, well, what's the point? You know, because you're not going to find somebody. And that's not what executive dysfunction is. I'm not exactly sure what that side of my head that's doing that is. Maybe that's depression, or I don't really know. But that feeds into the executive dysfunction, which executive dysfunction, I don't really know exactly how to, I don't even know if I'm saying it right. Let me look it up. Executive. Is a term used to describe the range of cognitive, behavior, and emotional difficulties which often occur as a result of another disorder or a traumatic brain injury. Individuals with executive dysfunction struggle with planning, problem-solving, organization, and time management. That's like what it says, but I have it because of Tourette's and ADD and probably other stuff. But the way I would describe it is like you're trying to like there, based on my experience, there's a stigma around it. People like to say that it's like laziness because, like my mom used to tell me growing up that I didn't do things because I didn't want to do them, which is just complete bullshit. Because like, granted, there's a lot of reasons physically why I don't dye my hair as much as I want to and need to, but the main reason is executive dysfunction. I also have this arbitrary rules in my head, I think is from my autism, where like I need to, let's say on Monday, I decide, okay, you need to dye your hair, but you're not going to dye your hair until Wednesday. And that gives me Monday, Tuesday, to make myself ready to dye my hair. And I have to like mentally, what do you call it? Like mentally prepare myself to dye my hair, even though, dyeing my hair, it's hard, but it's not like some kind of like ridiculously hard thing. It like, you know, holding my hands up above my head is difficult, but I can get a chair in there, and I have an actual chair that is tall enough to actually sit in and, you know, do all that stuff. I even bought a ring light for YouTube, a new ring light that's going to be able to have a mirror in the middle, which will really help, because another big issue with dyeing my hair is, even though I put new light bulbs in the thingy-mabobbers in the bathroom so I can see better, it's still super dark, trying to see where to put the dye on my roots. But that's something I want to do. So the fact that I'm avoiding dyeing my hair, you know, that should paint a picture of like, obviously, I'm not doing something simply because I'm a laziness or because I don't want to do it. So like with the litter box, it's disgusting, but I can go a few days without changing it, and I try to stay on top of it. But I can be sitting doing something, screaming at myself to scoop the litter box, and I won't do it. And you know, it's unsanitary, it's bad for the cats, a host of reasons why. And it's not because of laziness, it's because it's like my brain like paralyzes me. Like imagine sitting somewhere and needing to go to the bathroom, but you can't make your legs move. I'm not paralyzed in a spinal cord way, but it's like your brain is paralyzing you from doing that task. And no matter how many times you're screaming at yourself to fucking do it, you know, you can't do it. Something that I find that kind of helps is, let's say I need to go to the bathroom. I have interstitial cystitis, so the most toxic, I don't know the right words, but thing to do is to hold it. That just makes it worse, and it'll eventually probably cause a flare. But executive dysfunction makes me not want to get up and go to the bathroom. So I find that I will try to say, find other things that is not being blocked by my brain to do, and then once I'm awake, I'm up, I'll go to the bathroom. And that kind of helps, but it's not perfect, because, you know, it's just not perfect. And another thing is like, I can be sitting in bed and my phone will be dying, and I need to grab the charger that's like 2 inches away from my hand, but I can't get my arm to move. That's how I would describe this. And it's the most annoying thing, because then I'm like, your phone's gonna die, your phone's gonna die, your phone's gonna die, and then I get mad when my phone dies. And it's the most like, are you fucking stupid? Like, because you knew that was gonna happen, so why are you mad? But obviously I know it's not my fault, but it's like, you know, what the hell? And that plays a role with finding a doctor, and I need a doctor to help me with it. So it's like, the thing I need help with, or for, however you say that, is keeping me from getting help. And so besides that, I've looked for a therapist, and it shouldn't be this hard to find a therapist that is, you know, able to help me. I tried to find a therapist when I was younger, when I was 18. I have a lot of serious issues. So when I was younger, when I was in high school, I should go back a little bit. My parents only brought me to Christian therapists, and it was a type of, it was a therapist that was training. So I would see the therapist for 6 months, and then their training session would be up, and a new one would come in. And I understand why my mom did that, because she didn't have a lot of money, but it didn't make any sense, because seeing somebody for 6 months and then having to open up to a new person, you know, I never opened up to them, because why would I open up to somebody that's going to be gone in 6 months? Like, all that progress would be gone. And it felt like I had been to 2 mental hospitals at the time, because I tried to kill myself. And so it kind of felt like her way of giving me a therapist in a, like, well, look, I gave you a therapist, but did you really, kind of thing? Because they're here for 6 months, and what good is somebody that I can't really open up to, because I'm just going to have to do it all over again? What fucking good is that? It felt more of something like to save your own ass instead of actually helping me, kind of thing. And then on top of that, most of them are religious. And I have a lot of trauma surrounding that, like I've said. So that's my only real experience with therapy, is negative. And so when I became 18, and I'm like, you know what, it's time, I'm ready to get to work on myself. I'm tired of feeling like this. I want to actually get better, because, you know, you have to make that decision. I tried to find a therapist, and I had several therapists that I found that didn't want to work with me because of the level of trauma that I have. It's not a normal, and I don't even like to say normal. It's not something that most therapists have to work with, I guess you could say. And so most of them felt they weren't trained well enough to work on those things. So my plan is to not tell those people, to tell the therapist that stuff, that, and, you know, slowly creep into it, to try to avoid someone telling me that they're not qualified enough to work with me. So, you know, it's trying to find someone that's qualified, which I'm going to basically, it's not lying, it's just not telling them information off the get-go. I also have to find somebody that's not going to bring religion into it, which is hard in the Bible Belt. And then I need to find somebody that's a female, because I don't want to work with man. So there's more, like, criteria that I have to find for a therapist, and it's hard. And I have two insurances. One's a secondary and one's first or whatever. And trying to find a therapist for some fucking reason is hard. And then, so besides that, we're going to stop talking about the therapist thing. I want to talk about neurology. I found a neurologist, I think 3 years ago at this point. I was referred to him because I was having, Tourette symptoms, and we didn't know what it was. We did all kind of tests. We finally thought, okay, maybe it's Tourette's. So I got sent to a movement disorder neurologist or whatever. And I got diagnosed with Tourette's. And as soon as I saw him for 2 years, he was a good doctor. He wasn't perfect, but he was a decent doctor. He was going to put me on some medication. And then I got diagnosed with Ehlers-Danlos syndrome and dyskeratosis congenita. And I was told by my geneticist to give that paper to all my doctors. And I didn't think anything bad was going to happen. But he decided to stop being my doctor, basically. He wrote a letter basically saying that I was too complicated for him. And didn't think he could help me. But the place that he works at has a the hospital has a rule where you can't see another neurologist without that doctor's permission. So I don't know how to say it, because I don't want people to use it against me, and people are just assholes nowadays. He's basically dropped me as a patient without dropping me as a patient. He's done it in this way where it's like a legal gray area. I have an idea of why he's done this. I think he knows that he is being a lazy piece of shit, and he doesn't want the other doctors that he works with to know this. So to do that, he's keeping me from seeing other doctors at the facility or the hospital that he works at, by not allowing me to be able to see other doctors. So he will see me, but he won't run any tests. He won't give me any medication. He won't treat me at all. He'll see me, but he won't treat me, basically. And that's the legal gray area type of thing. So I'm stuck with having to report him, and I have been putting that off because I don't know how to say it. And I don't know what good it'll do to report him, because I have a feeling that when I report him, it won't do any good. And well, why don't you go to somebody outside of that hospital? The problem is, where I live, almost every single neurologist goes to that hospital. Literally, there's only, I think, 5 neurologists that don't go to that hospital for some fucking reason. I have no goddamn clue why. I saw one guy that was out of the hospital, and he won't see me because a previous neurologist that I worked with when I was 18, it was a neurologist that referred me over to the guy that's being an asshole. He won't work with me because he doesn't work with that patients. And so I'm just stuck, and I've been stuck like this for 2 or 3 years now. There's no way around it. What he's doing has to be illegal, and it has to be neglectful, because there are certain surgeries I need that I can't get because I need a neurologist to clear me, and he won't clear me. Because to clear me, they have to do tests, and he won't run those tests. So he's being neglectful, and he's putting my health at risk, and he doesn't seem like he cares. Hold on. Alexa, remind me to plug my fountain back in an hour.
Okay, I'll remind you in 1 hour.
Sorry, I had to do that. It's the cat's fountain. So, I have a feeling that I'm going to have to try to get a lawyer to sue him or something. Problem is, I don't have money, and I think he knows that. So, and I have a feeling I'm not the only person he's doing this to. I have talked to the hospital. I'm trying not to say the hospital's name. And they're no help, so I have to go to the patient resource center and tell them, but it's an email only right now because of COVID. And again, the executive dysfunction is making me put that off. So it's just this constant kind of just like, it's easier to pretend that it's not happening, and I think that feeling is what is feeding the executive dysfunction, because I just don't want to deal with it, because it makes me kind of want to cry and blow up. And to say I hate him is an understatement. I had a really terrifying thing happen where I had a CT scan, and they gave me some medication. I don't know what it was, but it was to kind of sedate me. They didn't fully sedate me, but ever since then, anesthesia has affected me negatively. And it wasn't anesthesia that they gave me. I think it was Xanax. They gave me enough Xanax to kind of calm down my tics. I don't tic when I'm pretty comfortable. So like right now, I don't really tic. I'm talking about ticking right now, so my nose wants to tick. Biscuit. Which is just a thing with Tourette's. For some reason, when you talk about it, it makes you want to tick. Woo! And for some reason, that makes people think you're faking it. Which is really fucking annoying. Hey, baby boy. Woo! So, crap. So, I don't know what I was saying. Anyway, it was a CT scan. I can't remember what it was. I think it was it was to check for moles and something else. Anyway, they had to give me contrast, and they had to put me, to kind of calm me down a little bit, so they gave me the Xanax to try to be still. But the longer I have to force myself to be still, the worse my Tourette's gets. I think that's true for most people. I don't know though. I only know my case of Tourette's. I'm going to be taking more because I'm going to be talking about it. But I'm pretty calm when I'm in my room for the most part. I have triggers like riding in the car, walking. If there's a wall beside me, for some reason I want to hit it 3 times. Woo! And so I was having 2 different CT scan things. So I was having to be still for a longer period of time. And when we got done, I went into a full-blown tic attack from what we're understanding. So bad that like several firemen had to hold me down. And I'm very weak. And so the fact that that much force came out from the tics is really bad. They ended up having to sedate me for several hours to try to get rid of the tic attacks because the tic attack was so... We're assuming it's a tic attack. We don't really know. But we're assuming it is. The tic attack was like so bad that they had to sedate me for that long to try to like... I don't know. But every time I kept getting out of the sedation, it was just worse. And ever since that, every time I get put to sleep, which sounds like a dog, but gets put under anesthesia, when I wake up, full-blown tic attack, like they're performing an exorcism on me and they just have to let it go. And it makes people not want to put me to sleep because we want to make sure that it's actually just tics and not some other underlining reason that my tic disorder or whatever is like acting up with anesthesia. I have one doctor that thinks it's because the part of my brain that is affected by Tourette's wakes up first, maybe, is what his assumption is. And because that side of my brain wakes up first, it just goes berserk. Because with Tourette's, you can kind of hold a tic in, kind of like you can hold a cough in. But the longer you do that, the worse it gets, type of thing. And the more tics you're going to have. But that part of myself that can, like, you know, try to hold a tic in and work through it, maybe isn't awake yet. We're not too sure, though. But this asshole doctor won't do any tests. Because... and I gave the letter to my PCP, and my PCP, which is my general practitioner, he basically said from reading it that the doctor just doesn't want to deal with it. He kind of just wants patients that are really easy, and when you have rare diseases and stuff and medical conditions like I do, you're more complicated because you can't just look at a few issues. You have to look at a whole list of issues on top of like all the medications that I'm on. You have to worry about like, is this medication going to interact with this? And you know, there's not any studies on it either, so the whole thing is just really fucking complicated and stuff. So I can get why a doctor would be apprehensive of working with somebody that has as many issues that I have. But he's being neglectful. If he doesn't want to work with me, that's fine, but allow me to see somebody else. So I don't know what to do. I really don't want to report him because I just don't want to deal with that. I don't have the energy or the anything. I just for one thing I just feel like an asshole, but he's being an asshole, and I'm hoping that when I write the email, which I should do now, but I'm talking to you, I guess, that maybe they'll reprimand him and I won't have to do that. But the main reason I'm putting off the email is because I think that once I do that, they're not going to do anything, and then I'm going to be forced to report him to like either like the big board in my state for medical doctors, and if that doesn't work, then I have to find a lawyer, and I don't have money for a lawyer, so I don't know what to do. Like, I guess I do, but like I just don't want to do it. I kind of wish I could just like ignore the issue, but I can't because it's affecting my other care. And like I said, the reason I think he's doing this is because he's a lazy piece of shit, and he doesn't want his other people that he works with to know he's a lazy piece of shit. Like, and he downplays everything, like, I have dyskeratosis congenita. And when you look up dyskeratosis congenita, it is like people with no nails and obvious skin issues and all this stuff. But just a few years ago, they were realizing that there's people like me that have DC and it doesn't affect them like that. It just makes them more susceptible for cancers, and their skin is a little funky. Like, it's not like, obviously it doesn't look weird. It just, like, my geneticist thinks that my DC caused my Ehlers-Danlos syndrome. There's no, like, proof around that. There hasn't been any studies about it because DC is so rare. But he thinks that instead of, like, me having the DC where my nails are gone, don't have any nails, and my skin has, like, patchiness and, like, a weird texture to it, he thinks that it affected my collagen, and that's why I have Ehlers-Danlos syndrome. So that's what the idea is for me, at least, and for what he said and all that stuff. I forgot my point. Anyway, he said DC is just something that makes your nails look funny, and you obviously don't have that. And what I've found that makes doctors really good is that you can find the doctors that want to learn the basic amount of shit to get their degree, and then they don't want to do anything else. They don't want to learn anything else. They don't want to learn about the new sciences. They don't want to learn about what used to be what was wrong, but you used to think was right, and how they, and all that stuff. Because science, the way science works is you have a hypothesis, and then once you test the hypothesis, you end up with the theory. And the theory can change because more information is constantly coming in. And so, let's say, I'm trying to think of an example. Can't think of an example without getting into religion. Basically, like, you think something is correct, but then more information comes in and you have to change your opinion, and the scientific community has to change how they view that. There are doctors, which I'm basically positive this is how this doctor is, where he wanted to learn just the limited amount of shit to get his degree, and he doesn't want to continue his education. A good doctor continues their education and keeps updated with how everything is changing as more information comes in. He's the type of doctor that just wants to deal with the most easiest cases. He doesn't want to think too hard, and all that stuff. You know, he's not the type of doctor that's going to want to write a paper. He just wants easy cases and to go home and not have to think about work anymore. And, you know, that's fine, but it makes not a great doctor, because he is now putting me at risk because of his fucking ego. And it makes me so mad. So I have some good doctors. Some of them don't really want to be educated anymore. They did their schooling and they're done. And they help as much as they can. But there are some doctors that I have that have written papers and they continue their education. Those are the best doctors, because they're constantly learning, and that means they're constantly adjusting their care based on what comes out and what people learn about stuff. I actually see a doctor that found the connection between POTS and EDS, and he's a pretty famous doctor because of that. Yeah. I don't know. All this stuff really puts into perspective how, like, people think, like, living a life with chronic illness is kind of simple. I had one person that I know that said how nice it must be to not be able to work, but, like, I work, I just don't get paid. You know, taking care of my care is a full-time job. I'm constantly having to talk to doctors. I'm constantly having to talk to insurance companies. I basically need a personal assistant. Almost probably every single person that has a chronic illness or disability needs a fucking personal assistant. We just can't afford it. And my mom has to do a lot of it because I just can't keep track of it all. But I don't really think I have anything else to say. I just wanted to vent. What, baby boy? But yeah, hopefully I find a therapist soon. And hopefully I figure out the neurologist situation. And honestly, hopefully he gets in trouble because he deserves it. I don't even think he should be able to practice anymore because this is like, I don't know if it falls under malpractice or not, but it's pretty close at least. So, what? Come here. You say hello? You say hello? You're handsome. You know that? Meow. You're handsome. You're handsome. I love you. Do you know you could be a kitty model? Okay. But yeah, now I have fur all over my face. I think I'm gonna go. I'm gonna save this, and stuff. But yeah, thanks for watching and listening and all that stuff. I appreciate it. I'll update y'all if I have anything else to update. But that's basically it. Bye.